Honourable Speaker, the federal government committed $5 billion into healthcare infrastructure over the next 3 years. This commitment immediately made me think about the promise the Premier made during the election when he committed to the people of North Winnipeg that he would bring back emergency services to the Seven Oaks Hospital. We are more than halfway through this provincial government's mandate, and we have heard nothing, not even a plan. Now that there's an opportunity for matching funds, will the Premier commit today to use these funds towards the reopening of Seven Oaks ER?
The Honourable Minister of Health, Seniors and Long-Term Care.
I want to thank the member for Tyndall Park for reminding all of us of the magnitude of the damage that was done by the previous government to close 3 of our largest and most significant emergency rooms here in Winnipeg and fired the healthcare workers, including nurses, who staffed them. On this side of the House, we have made a commitment to Manitobans to staff up the front lines first and foremost, and that would allow us to take the steps of reopening emergency rooms. Over 3,500 net new healthcare workers and growing means that we can successfully reopen Eriksdale and, of course, the Victoria Emergency Department. That work is well underway, Honourable Speaker. And, of course, we're going to keep moving in the direction that allows us to reopen the Seven Oaks ER. It's important that we do everything we can to build capacity across the healthcare system and make sure no matter where you live,
Member,
you get the
time has
healthcare
expired. The Honourable Member for Tyndall Park on a supplementary question.
Honourable Speaker, during the last election, the Premier campaigned on reopening the ER at Seven Oaks Hospital. We now have the federal government who has committed $5 billion towards healthcare infrastructure. Will this provincial NDP government commit to Manitobans that they will provide the matching funds for any healthcare facility in Manitoba, or are we going to miss out?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, I thank the member for that question. We're still, working on getting a bit more clarity from Canada in terms of the details of that commitment. We had a really great but very brief FPT with the Federal Health Minister, Michelle, last week to talk about that and other items that they brought forward. And we're going to keep working with our partners at the federal level to make sure that here in Manitoba, we're making investments that strengthen healthcare. I would ask and encourage that member to talk to her federal Liberal member colleagues and ask them to advocate for Manitoba to get our fair share. Happy to work together with her on that. And I just remind her and members of this House that members on that side of the House were the folks who made devastating cuts to healthcare. On this side of the House, we're fixing it.
The Honourable Member for Tyndall Park on a final supplementary question.
Honourable Speaker, in the last provincial election, the Premier of Manitoba campaigned on a promise that he will reopen the ER at Seven Oaks Hospital. Another throne speech has come and gone, a list of priorities that this government is committing to make over the next year, and there was not one mention of Seven Oaks Hospital ER, Honourable Speaker. The North End continues to be neglected under this NDP government. With the new federal investments, $5 billion being provided for healthcare infrastructure, will the Premier commit today to the reopening of the ER before the next election?
The Honourable Minister of Health, Seniors and Long-Term Care.
Honourable Speaker, I certainly appreciate the members' energy around advocating for that part of the city and the province. We've worked very hard as a government to build more capacity. I, very early on in becoming the minister, sat down with folks at Seven Oaks and heard their concerns. We made increased investments so they had more physician capacity at that site. We've made sure they can hire more doctors to practice at that site. We've also been looking at ways that we can enhance primary care services. More to share on that with the member in the coming weeks and months. I want to reassure her that we're doing everything we can to build back the capacity that was cut and closed by the previous PC administration. We care about the health outcomes of Manitobans. On that side of the House, they only cared about chaos and closures.
Time has expired.